Hello, Nicola. Thanks for making the time to chat with me today. How are you?
I'm good, thank you. How are you?
I'm really good. You are somebody that we work closely with in the community, but at the same time, I rarely get to talk to you. We kind of share clients and refer back and forth, but it's nice for us to actually be able to have a conversation today. And I'm excited to talk about why your work is relevant to the work that I do. But first, why don't you take a minute to tell people a little bit about what you do, who you are?
Yeah, so my name is Nicola Robertson. I'm a physiotherapist and I have a special interest in pelvic health and persistent pain, which we'll be talking about today. And I kind of came to that realization of pelvic health through my own personal experience, which is fairly common. So I went down that road and decided to open my own clinic. So I also have my own clinic.
Amazing. Yeah, so Nicola is a pelvic floor physiotherapist. That's the part of her work that really overlaps with the work that I do as a holistic reproductive practitioner and a doula. And I'd like to have a conversation today about why pelvic floor physio is specifically important for people who are trying to conceive. So sometimes I don't get to refer people to you until they're already pregnant because maybe I didn't know them when they were trying to conceive, or it's sometimes hard for people to understand why it's a priority when they're trying to conceive. And then sometimes I refer people to you when they're already postpartum. And there's a lot that you can do during pregnancy and postpartum, but I really want to focus on that preconception and the benefit of starting before there's a baby in the uterus. Did you want to start?
Yeah. So even just from a general health perspective, a lot of people have little to no awareness of their pelvic health, their pelvic floor, what it does, how it does those things. So even to get yourself to a pelvic floor physiotherapist, and most of them will do this and do like almost like a wellness check. Like, where am I at? What do I need to know that I don't know about? I mean, even simple things we talk about, like basic hygiene. A lot of women don't understand to wipe front to back. We also see people who don't even know their anatomy, the vulva, vagina, anus, or they're separate. And that's it's okay. There's no shame in not knowing these things, but finding someone who can maybe help you with that. And then when it comes into fertility, and I do see people for fertility, not that I am somebody who guarantees a baby, as it's similar to you, Michelle, but more of there are things that can be going on that's preventing that from happening. So everything from, I've seen women who cannot have penetrative sex, which is a huge issue with conceiving. Not impossible, but very, very difficult. Even to problems with the pelvic floor, muscles being tight, not able to relax during sex, or even having some mechanical infertility. So even things where there's not enough mobility around the cervix, and things are kind of not working. So that's what I see a lot of people for through that phase. And it's been interesting because I've had a few people accuse me of getting them pregnant. I definitely didn't, but
Yeah, I've had a few of those accusations as well. It took 3 to make this baby. And it's like, whoa, careful who you say that to. That sounds like not what I do.
right.
I will tell you that when I have pregnant clients who tell me that they're going for pelvic floor physio, and especially when people preconception tell me that they're going as a doula who's going to be attending their birth, it's like, I feel so much relief because having attended many births and especially attending births with the same person multiple times, I've really seen the benefit of pelvic floor work. So I guess what I'm trying to say is, if I've been with somebody and they had like 30 hours of labor, including most of it generally is the early labor when labor goes like that. And then they end up with a C-section. And then at subsequent births, they've had pelvic floor physio, gone to prenatal chiropractors, and they have like 10-hour births with bigger babies. That's been the thing for me that I want all of my clients to go for, one or both of those things, because a lot of people are told that their pelvis isn't large enough to birth their baby. And then now I understand it's not the bones. So do you want to talk about that a little bit?
Yeah, so that's one of my absolute pet hate phrases. And it does happen. There is an anatomical, but it's so rare. It's not, I believe the stats is like 0.5%, but I need to check them to be sure. I think what happens is a lot of women aren't prepared for labor. They tend to go into this tension state, or they're already in a tension state before they start, and the muscles just react more so, and it kind of restricts the ability of the cervix to dilate. It just, you can't get into a good position to allow baby to descend. You know, once interventions start happening, things like epidurals, not that they're bad, just they can slow things down. And I think a lot of people don't realize they have choices when it comes to C-sections as well. You know, your baby's measuring big doesn't mean you can't have that baby. I had very large babies. And I don't think people really understand you can prepare yourself for labor and birth. And that can be through learning how to breathe and open and relax your pelvic floor, but also being able to do a Kegel and contract that pelvic floor when need be.
Yeah, I've definitely seen the difference. Like, so some people have too much tension in their pelvic floor, right? And then we've got people who have not enough. It's too relaxed, maybe.
Yeah.
But I think too, one of the biggest problems is an imbalance. Does that sound accurate to you? Like when it's different on one side of the pelvic floor than the other, then we get these babies with tilted heads trying to come down and it doesn't work.
Yeah, and a lot of people as well kind of don't, you know, we're all a little bit different left to right. That's not unusual. So I don't want people watching or listening kind of panicking that they're not even. But we should see things being closer together. Like if we check, like using your grip strength as an example, your right and left grip strength should be similar, not the same. So I see that a lot in pelvic floor dysfunction, is that people will be very, very tight on one side, the other side's doing a great job, but then when things start happening, even thinking about incontinence and pregnancy, people are kegeling, but that overly active side gets even more overactive, and it just doesn't allow baby space to turn and move. So even educating people on how to prevent that and how to reduce the symptoms, you just see big changes. And I think as well, even just understanding what perineal massage is, that's a huge piece that I teach it way earlier than the evidence suggests. I teach it around 28 weeks because it's also a really good opportunity to explore your own pelvic floor and know how to breathe and relax. It's a really good visualization tool.
Nice. How is there a way for people to know, like what I would suggest to anybody who's watching this, who has the means to get to a pelvic floor physiotherapist when they're trying to conceive, that they just should, because in my experience with my clients, after they've gone to see you, you teach them about what's going on inside their body that they otherwise wouldn't have known, which is really good for me to know when they tell me like, oh yeah, they said that things are really tight or, you know, too loose or whatever. It kind of helps me prepare for their birth and what kind of support they might need. But for people who are watching this, who've never been to a pelvic floor physio, who are trying to decide whether or not they should go when they're trying to conceive, are there indicators that will help them know right now the condition of their pelvic floor before they even see you?
Yeah, so a couple of ways you can check. First of all, see if you can actually do a pelvic floor contraction. So sitting at home, try and lift your perineum, which is the space between your vagina and anus, up, and then let it go back down. And that's the trick. A lot of people are like, oh yeah, I can Kegel all day, but they can't let it go. So you should be able to relax those muscles. Another good indicator is your back and hip mobility. So your pelvic floor muscles are actually involved in your back and your hips. So if you're someone who isn't so good with hip mobility, can you lunge? Can you squat? Can you sit in a butterfly position? And if you're having trouble with those, that could be an indication there's a pelvic floor dysfunction underneath.
I'm really glad you said that. And I actually didn't know that that was something that, I mean, obviously you can help with that, but I didn't know that would be part of what you would be investigating with clients, because I remember one of the clients I supported, I didn't know until at her birth that when she walked, she noticed she was having a really hard time lifting her knees very high. And then I was kind of shocked during the pushing stage with her lack of mobility in her hips. And it was really hard for her to make space for the baby to come through. And she had a really, really, really bad shoulder dystocia. Everybody was okay, but in reflection, I was like, shoot, had I have known that she was having trouble even just walking, maybe there would have been things that like you could have done to support her to, and then her birth would have been different, you know?
Yeah, and I do, with a lot of people who come to see me during their pregnancy, we do go through a series of exercises based on preference, to try and keep you strong and active for labor. I think people don't realize that you should actually train for labor. People will be like, oh, I really want to give birth in sight on my side. And I'm like, how's your leg strength? Can you hold your leg up? And it turns out they can do it for about 15 seconds independently. And, you know, even if you have a support person, you're still going to have to be able to do it yourself, just because that's what the muscles do. And people are really shocked that, you know, you should be keeping active. I think as well, a lot of people are scared to be active during pregnancy, but there's no evidence other than guided by healthcare providers that we shouldn't be. And those things can lead to a more successful labor. If you're able to keep active, keep walking, keep moving, babies tend to get into better positions, and you have more options when you're in labor of where you can be. And if you can move around, again, that can help get things going.
Our C-section rate and our rate of intervention is really high where we are in history. I mean, our birth outcomes with regards to infant and maternal mortality are fortunately really low. Like generally you can give birth, we're not, you know, in most situations, we're not afraid of like not coming out of it. That's not necessarily the case for Black mothers and Black birthing people, but surviving is one thing, but the rate of the intervention needed just to get the babies out is really high. And when we think back, like how did we give birth before if 1/3 of babies need to be born surgically now? But I try to help my clients understand that our lifestyles are not like our ancestors. We are a lot more, well, we were talking before we started recording this about how much time you and I are spending on Zoom these days. We have very sedentary lifestyles. And for example, other red flags for me when I'm learning about who my clients are, if they have a lifetime of horse riding history, especially that English style, if they were competitive figure skaters or gymnasts, marathon runners, those are, even though those are active things, we also take some of those things really far, you know, and they're the ones that I'd be like, oh my gosh, please go and see Nicola, consider going for some prenatal chiropractic. And that always helps. So did you want to speak a little bit to our modern lifestyle or how you think the outcomes for your clients might be different than the general population?
Yeah, I think giving people the power to, like, so a lot of what I do, similar to the work you do, is explaining to people like choices and, you know, having that open conversation with their primary healthcare provider, be it a midwife, be it an obstetrician, so that they really understand why interventions would happen. And educating people as to what each intervention is and what the potential consequences, not to frighten people. Things can happen post any kind of birth, but people need to, we can't make decisions if we're not informed about what could happen. And I think, yeah, we spend way more time sitting. We spend very little time sitting on the floor. A really good predictor of aging is actually sitting on the floor with your legs crossed and standing up without your hands. We won't look at me doing that, but that's irrelevant right now. But yeah, you're right. And I find, you know, we have these kind of, you know, people who are seated all the time and then they're doing high level activity in their spare time. And what's actually happening, we see it actually in female athletes have very tight pelvic floors. And there was research out of the States that showed young women who'd never had babies, high-level athletes had I think it was around an 80% incidence of incontinence, which is way higher than the general population. And incontinence is not caused by weakness. It can be caused by tension as well. And I think educating mums on being confident in trying to move and moving any way they possibly can. You know, we are a sedentary population. We just sit and, you know, thinking about the positions we want to be in for labor, not one of them is sitting. So, you know, I think, and I'm thinking about encouraging baby position, and I am nowhere near an expert, but have done a little bit of reading on that. You know, we know sitting doesn't encourage babies to get into that nice head down, face down position. They go the opposite. So, yeah.
Yeah, I definitely think that dancing, walking, swimming, prenatal yoga are all really healthy ways to keep mobile during pregnancy. But for sure, for anybody who has that history of really competitive or even just continuous athleticism at a high level, you probably should get those things checked out, so that I picture it like rubber bands and the baby's just kind of bouncing on the rubber bands rather than navigating these buttonholes, you know? Yeah, so I think that's sometimes what happens with birth, and people, you know, struggle to get past like 3 centimeters dilation, or the baby stays really high. And so getting help and support to get those rubber bands to be a little more relaxed or balanced is probably a very good idea. And like I said, starting preconception makes a lot of sense. What do you think the benefit is to people postpartum who start their pelvic floor work preconception, or at least in pregnancy? I mean, you probably see so many people who come after they have the baby when they're actually having really big problems. How would it be different if they started sooner?
So the patients that I see, and I encourage lots of my clients to see me through and postnatally, and it is really, first of all, an understanding of what they may see afterwards and what they may feel afterwards, and that's normal, it's not scary. You know, all these things are manageable. And I think I see them less. Realistically, the patients who come to me from preconception or during their pregnancy, postnatally, I'm seeing them half as many times. So maybe 2 or 3 times versus 4 to 8 times. You know, it's a big difference. They just have more awareness. We've already established what postnatal looks like, which is different for everyone, but you know, what's safe, what's not safe, what you need to watch for, monitor for, when you need to be seeking out additional help. And I think just giving people a bit more power back and being able to give them that from day one postpartum, rather than the, hey, 6 weeks of absolutely nothing, you can't do anything apart from look after a completely dependent child, but you know, don't dare go for a walk or walk upstairs. And you know, the information isn't well balanced, that because we live in a society where we're always, as healthcare providers, we've always got to watch our own backs, so we give people less power in case something goes wrong. But the reality is it very rarely does. If anything, people get better faster. So yeah, they get better faster if they come to see me sooner, and they're not as shocked. They don't come in so shell shocked with the whole labor and delivery process.
And is there anything that you can speak to? Because I actually don't know about this. A lot of what I do is helping people heal reproductive health conditions, get periods more regular, those kinds of things. How does pelvic floor physio fit into the health of the reproductive organs? Like, obviously everything down there is connected, and the pelvic floor affects like the position of the uterus and the bladder and all of that. Yeah. So it would make sense to me that taking care of the pelvic floor is also going to help the pelvic or the reproductive organs heal faster too.
Yeah, so I do some what's called fascial work, or visceral fascial work. So that can be very beneficial. I treat a lot of people with endometriosis, which I'm sure you do as well. And from a pelvic health perspective, the same things happen. Tension in the pelvic floor, poor bowel movements, which can have a big consequence on fertility, from what I understand, because things just aren't flowing. So a lot of it is education, pain management. I see lots of young females now coming in with the complaint of painful periods, which we know probably means something is not going well. So again, we can mobilize at the cervix, we can do external treatment. So a lot of people think if they come to pelvic floor physio, we're going to be in your space, but I do a lot of external work as well. So even mobilizing around where there's maybe endometrial adhesions, so bladder mobilizations, we can mobilize around the uterus and the abdomen, and again getting people moving and giving them the power back to manage what's going on for them.
And because you brought it up, being in people's space, why don't we maybe finish this off by giving people a heads up of what to expect when they come for pelvic floor physio work? Oh, and we should also maybe speak to men or biological males as well, if you want to.
Yep. So I do see men as well. I see men for everything from erectile dysfunction through to men who've had prostatectomies. And again, men are very much more timid about coming, but again, it can be a mechanical restriction. It can be a pelvic floor weakness. So erectile function comes directly from the pelvic floor. We culturally have given men the little blue pill, and when that doesn't work, we're kind of stuck. But checking those pelvic floor muscles, which again for men does not mean I look at their erection or their penis or their testicles. I'm really looking at the internal muscles. When we do pelvic floor physio, so a lot of people understand what's going to happen, but then other people are quite shocked by it all. So we do suggest a pelvic floor exam, which would be an internal exam, vaginal and or rectal, depending. The purpose of that is so we can feel those muscles internally. We can do a lot externally if someone's uncomfortable, trauma, there is restrictions. I've had clients who are on pelvic rest, so we would not do an internal exam with them. And it's not uncomfortable. It's not a pap smear. We don't use speculums. We only go at the pace you're comfortable at any point. People can withdraw consent and we stop what we're doing. I try and talk to people as we're doing it and kind of make light conversation. I think we have in society made our genitals, our pelvic floor region, something we should shy away from and not discuss and talk about. Same when it comes to sex. We like to make fun of it, but we don't have serious conversations around it. And one of the things I try and strive for in my practice is just having an open conversation. And there's never too much information in my job.
Perfect. Is there anything else that you want people to know that we didn't cover regarding pelvic floor work and reproduction or reproductive health?
No, not at the moment. I think that was fairly succinct, and people can always reach out to you and get in touch with me if they have specific questions.
And how do people reach you? How do they find more information about the work that you and your team are doing?
So I own a clinic called Diamond Physiotherapy, which is diamondphysiotherapy.ca. That's probably the easiest way to find me. And if you contact the clinic, they can direct you. But we do also have two Instagram pages. One is Diamond Physiotherapy and one is Nicola Physio. The Nicola Physio is probably a bit more geared towards pelvic health, but you can contact me through either.
Wonderful. And I just want to personally thank you again, because like I said, my first priority is always client outcomes and client satisfaction and client healing. And when they're happy, I'm happy. But then selfishly too, if I attend a birth and somebody's had pelvic floor physio work and it's a lot shorter than the average birth I attend, then that's always a bonus for me as well. So I think we make a great team, and I'm really grateful that you provide the very important work that you do for our mutual clients in our community.
You're very welcome, and thank you for all you do as well.
Thank you for taking the time to chat with me today, Nicola. And I hope that you just moved into a new clinic. And I hope that transition has gone very smoothly for you and everybody that you work with. And I'm sure you'll continue to be as busy as you want to be.
Thank you very much, Michelle.
All right. Thanks a lot.